Adrenal gland part 3. In this video, we'll discuss the important technical points regarding MRI imaging of adrenal gland through a clinically based questions. This video aims to know the principles of adrenal MRI protocol and some important basic physics used in adrenal imaging. Question number 1. MRI of the adrenal gland can play a vital role in adrenal lesion assessment. Which sequence is considered a key sequence for adrenal mass characterization? T1 and T2 spin echoes, T1 and T2 spin echoes with fat suppression MRI sequences, T1 weighted dual echo gradient recalled echo, or T1 3D gradient pre and post contrast with fat suppression. The answer of this question is a choice C, T1 weighted dual echo gradient recalled echo. This long name of that sequence has a more shorter and common name, which is called chemical shift sequence. Chemical shift sequence is common sequence used in the body imaging, and it is a gradient sequence, T1 gradient sequence with a small flip angle, and it has two main components, the in phase and the out of phase. The out of phase component, also known as opposed phase. Question number 2. Regarding the chemical shift sequence on adrenal MRI protocol, this sequence is designed for detection of India ink artifact or microscopic fat or macroscopic fat or both macroscopic and microscopic fat. The answer of this question is a choice B, microscopic or what we call intracellular fat. Adrenal nodules that contain homogeneous lipid is likely to be adenoma, with few exceptions. Those exceptions we'll discuss it later in the pathology section. Detection of microscopic fat could be achieved by using the chemical shift sequence, while the macroscopic fat usually is not affected by the chemical shift sequence and could be detected and affected by another MRI sequences like fat suppression sequences and stir sequences. India ink artifact, it appears only on the opposed phase image, and that causes the abdominal organs to be delineated by a dark line wherever there is interface with the abdominal fat. These images are examples of the two main components of the chemical shift sequence, the in-phase and out-of-phase sequences. On the opposed phase, we can notice that there is a dark line outlining the abdominal organs, like a black ink, and it's called India ink artifact, demonstrated by the yellow arrows. This dark line appears only on the opposed phase image, but not in the in-phase image. These lines appear at the interface between the tissues composed mainly of fat and those composed mainly of water. And so, we can use this artifact as a useful point for identifying the out-of-phase images, and also reveals the presence of fat within a mainly water-containing structure. Question number 3. What are the main criteria of the spoiled gradient echo sequence that make it more favorable than a spin echo sequence? Please choose the right answer. The answer of this question is a choice A. It has a smaller flip angle, shorter repetition time, and shorter echo time. and this make it has faster acquisition time. Both spin and gradient echoes imaging are the main components of the abdominal MRI studies. Gradient echo imaging, characterized by small flip angle, shorter repetition time, and shorter echo time, make it has a shorter scan time compared with the spin echo imaging. However, due to it is a fast scan, it has a special type artifact named as residual transverse magnetization. This artifact make the contrast resolution of the T1 became degraded. To correct this artifact, a new modified sequence called spot gradient echo has introduced in the current imaging studies. This new technique make the gradient sequence more faster scan and at the same time reduce the effect of the artifact of residual transverse magnetization. The choice D is not correct because it demonstrates the parameters of the traditional spin echo imaging, and choices B and C are not related to specific MRI sequences. Question number 4. T1 weighted dual echo gradient, recalled echo or chemical shift, is an essential sequence in body imaging. What's the main disadvantage compared with spin echo? It is a faster sequence, it is more susceptible to image contrast degradation. It has a shorter TR and TE, thus it is more susceptible to T2 star artifact. It has a 3D capability, thus reformatted images could be obtained, or choice A and B. The answer of this question is the choice D. There are two main disadvantages of gradient sequence are known. One we already have discussed, which was residual transverse magnetization, which affected the contrast resolution of the image and was corrected by using the updated technique known as spoiled gradient echo. Another disadvantage of the gradient sequence when applying chemical shift is what we call T2 star artifact. T2 star artifact has a potential effect to reduce the signal intensity of the lesion, including adrenal lesions, making the expected loss of the signal at adrenal lesion difficult to be completely attributed to the presence of microscopic fat, leading to potentially compromising the diagnostic accuracy. Question number 5. Female patient in the second trimester presented with acute right iliac fossa pain with mild elevation of leukocytic count. Ultrasound was normal. The surgeon decided to do an MRI to exclude appendicitis. During the MRI exam, there is a small left adrenal lesion 1.5 centimeter. Thus, the radiologist has decided to perform a chemical shift sequence. What's the best echo time of this sequence? Please choose the right answer. So the answer of this question is a choice D. The echo time represents the time in which the protons of both fat and water to be in the same location during the precession cycle. At 1.5 Tesla, the phase shift from the in phase to the opposed phase occurs every 2.2 milliseconds, and at 3 Tesla it occurs every 1.1 millisecond. This means that at 3 Tesla the echo time of both opposed and in-phase sequences is half of that at 0.15 Tesla. And remember also all sequence parameters must be identical except for the echo time. Question number 6. The vast majority of adrenal lesions are adenomas. which contain intracytoplasmic or what we call microscopic fat. So what's the characteristic qualitative imaging finding on chemical shift to detect intracellular lipid at adrenal lesion? Presence of India ink artifact between adrenal lesion and abdominal fat, homogeneous drop of signal on in phase compared with opposed phase, or homogeneous drop of signal on opposed phase compared with in phase, or heterogeneous drop of signal on opposed phase compared with in phase. This is an example of adrenal adenoma on the in phase and opposed phase. We can notice that in the on in phase image, the adrenal lesion, which indicated by the white arrow, it's almost isosignal to the liver, isointense to the liver, while on the opposed phase there is significant homogeneous loss of its signal and become significant darker compared with the in phase. Additionally, we can notice the yellow arrow refer to the India ink artifact encircling and outline the abdominal organ on the opposed phase. The question is, why this drop of signal occurred on the opposed phase? We discuss this in the next slides. If we check this diagram and imagine that the yellow color represented the abdominal fat into the abdomen, and the lesion has two components, fat and water components. And when applying the chemical shift sequence on that lesion, we'll find that during in phase, the water and fat components, each one of them will give signals. These signals will be directed to the same direction. So, the signal of this lesion become more brighter and the signals are additive to each other. While on opposed phase sequence, the signals of both water and fat will be directed to the opposite directions. So their signals cancel each other. So the signal of the lesion will be darker on the opposed phase. So any lesion has microscopic fat should has homogeneous drop of its signal in the opposed phase sequence. And also we can notice the dark line which encircling the lesion, which represent the India ink artifact as we discussed it before. If we check this diagram, we'll find that we have a lesion with only one component, water component. There is no fat component. So we have one group of the signals. Its intensity and the brightness will not change from in phase or on the opposed phase sequences. So there is no drop of the signal on the opposed phase will happen as happened in the previous lesions because only we have one group of the lesions of the same degree of the signals and the same degree of the brightness. So the answer of this question is the characteristic qualitative imaging finding on chemical shift to detect intracellular lipid at adrenal lesion is homogeneous drop of signal on opposed phase compared with in phase imaging. Question number 7. On chemical shift, T2 star effect is an undesirable phenomenon that can reduce the signal intensity of the suspected adrenal lesion, which decrease the diagnostic accuracy. To reduce this effect, the following should be applied during MRI exam. The in-phase echo must always be acquired before the opposed phase echo. The opposed phase echo must always be acquired before the in-phase echo. Use a long echo time as possible. adjustment of the flip angle equal to 90 degree? The answer of this question is choice B. The opposed phase image must always be acquired before the in-phase echo image. As we discussed before, one of the disadvantages of the gradient sequence is the T2 star artifact, which has the potential effect to reduce the abdominal organ signals, this including adrenal lesions itself, leading to interfere with the diagnostic accuracy. Thus, to minimize the effect of T2 star artifact on opposed phase image, the opposed phase must always be acquired before the in-phase echo to prevent and to minimize this effect and to prevent the overlap between the adenoma and other lesions. A choice C is not a correct because in the chemical shift we should use the shorter echo time as possible to minimize the effect of T2 star artifact. Additionally, the choice D is not the suitable answer because flip angle equal 90 is designed for the spin echo sequence, which it shouldn't be applied in this scenario. Question number 8. Adrenal adenomas mostly presented as homogeneous loss of signal on opposed phase T1 weighted dual echo gradient recalled imaging. What's the best abdominal organ used usually as a reference for the assessment of signal loss compared with an adrenal lesion? This organ could be the liver, spleen, the contralateral adrenal gland, or the ipsilateral kidney. The right answer is choice B, spleen. A splenic tissue doesn't have internal fat content that might affect the qualitative reading and interpretation at the liver, in which in many cases presented with fat. On the other hand, the pancreas could be a misleading organ as it has a potential formation of the India ink artifact along its interdigitating margin. Additionally, the kidney is not a common to use as a reference organ because it is not completely appear with the same orientation of the adrenal gland. So it's difficult to be compared with the same slice section. Question number 9. One of the new MRI sequences have applied in the last few years is Dixon method. Which statement can best describe this sequence? Modified Dixon is a more sensitive than original Dixon. It consists of 4 sets of images, water only, fat only, in phase and opposed phase. It can be used for detection and the quantification the amount of fat or all of the above. The answer of this question is the choice D, all of the above. Dixon method is an MRI sequence based on chemical shift and designed to achieve a uniform fat suppression and less affected by artifacts than many other techniques. It has a 4 components: water image only, fat image only, in phase and opposed phases. It can be used for detection and quantification of the amount of the fat. Finally, take home message. Remember that chemical shift sequence, or what we call T1 weighted dual echo gradient, is a key sequence for adrenal MRI protocol. And this sequence is composed mainly from 2 components: the opposed phase and in phase sequences. To discriminate the opposed phase image from the in phase image, try to identify the India ink artifact, which is indicated by the yellow arrow. And this artifact is a dark line encircling the body organs and represent the interface between two tissues. One of them has mainly fat content and the other one mainly has water content. Remember also the difference between gradient and spin echo sequences as shown in the table here. And as a rapid hint to know what sequence you are dealing with from the image, just look at the value of the flip angle. If you found it equals 90 degree, so you are dealing with a spin echo sequences like T1, T2 or proton density sequences. If you find it 30 degree or less, so you are dealing with a gradient sequence, either convention gradient sequence or Dixon method or chemical shift sequences. Gradient sequence has two main artifacts. The first one is called residual transverse magnetization, which minimize and decrease the contrast resolution of the image, especially on the T1 images, and it is corrected by applying a modified technique, what we call a spot gradient echo sequence. This sequence has a shorter scan time than the convention gradient and minimize the effect of the residual transverse magnetization. The second artifact presented in the gradient sequence is the T2 star artifact. T2 star artifact had the potential effect to decrease the signal intensity of the abdominal organ so it can interfere with the diagnostic accuracy. And this is corrected by using the shortest echo time as possible, and don't forget that scan a post image before the in-phase image. The Dixon method is an MRI sequence based on chemical shift and is designed to achieve a uniform fat suppression, and it has less affection by artifacts than many other techniques. It has mainly four components: water image only, and fat only image, opposed image, and in-phase image. Additionally, modified Dixon is used for quantification of fat. In the ink artifact is present only at the opposed phase image, and it's formed when there are two tissues. One of them has mainly fat content and the other has mainly water content. And this artifact is formed at the interface between the two types of those tissues. Finally, remember that chemical shift is designed for detection of microscopic fat, or what we call intracellular fat, and the key imaging finding is drop of the signal in the opposed phase image, and don't forget to use spleen as a reference organ. Finally, these are the references for further reading, and please subscribe to the channel to be aware by the coming videos, and thank you.